breastfeeding benefits for baby and mother. Breastfeeding has a number of benefits to both mother and baby, which infant formula lacks. Breast milk. Not all of breast milk's properties are understood, but its nutrient content is relatively consistent. Breast milk is made from nutrients in the mother's bloodstream and bodily stores. It has an optimal balance of fat, sugar, water, and protein that is needed for a baby's growth and development. Breastfeeding effectively defends against infectious diseases for the infant. The breast milk also has long-chain polyunsaturated fatty acids which help with normal eyesight and nervous system development. Health organizations, including the World Health Organization, recommend breastfeeding exclusively for 6 months. This means that no other foods or drinks, other than possibly vitamin D, are typically given. After the introduction of foods at 6 months of age, recommendations include continued breastfeeding until 1 to 2 years of age or more. Breastfeeding offers health benefits even after infancy. These benefits include proper heat production and adipose tissue development, a 73% decreased risk of sudden infant death syndrome, increased intelligence, decreased likelihood of contracting middle-ear infections, cold and flu resistance, a tiny decrease in the risk of childhood leukemia, lower risk of childhood-onset diabetes, decreased risk of asthma and eczema, decreased dental problems, decreased risk of obesity later in life, and a decreased risk of developing psychological disorders, including in adopted children. In addition, feeding an infant breast milk is associated with lower insulin levels and high leptin levels compared feeding an infant via powdered formula. Research indicates breastfeeding has positive effects on the mother's and child's mental health. These benefits include improved mood and stress levels in the mother, lower risk of postpartum depression, enhanced social-emotional development in the child, stronger mother-child bonding, and more. Given the benefits of breastfeeding, the World Health Organization (WHO), the European Commission for Public Health (ECPH), and the American Academy of Pediatrics (AP) suggest exclusive breastfeeding for the RST 6 months of life. Breastfeeding positively influences the mother's mental and emotional well-being as it improves mood and stress levels, and it is referred to as a stress buffer for mothers during the postpartum period. The activity facilitates a calmer psychological state and decreases feelings of anxiousness, negative emotions, and stress. This is reflected in their physiological response to breastfeeding, where the mother's cardiac vagal tone modulation enhances and blood pressure and heart rate decreases. The stress buffering effect of breastfeeding results from the hormones oxytocin and prolactin. Mothers who breastfeed experience enhanced sleep duration and quality, while instances of sleep disturbances are decreased. The activity positively influences how mothers respond to social situations, which facilitates improved relationships and interactions. Mothers who engage in breastfeeding respond less to negative facial expressions, example anger, and increase their response to positive facial expressions or happiness. Breastfeeding also helps mothers feel confident and empowered given the knowledge that breastfeeding is beneficial to their child.